your fingers lock or click when you try to use them can start out as just a nuisance, but if not attended to, can turn into the inability to use your hands. We tend to gloss over them in our clinics and say, oh, that's just a trigger finger. But understanding what they are and if they are a sign of a bigger issue can really make all the difference. So today, let's talk about what trigger fingers are and why they happen, what questions will give you and your doctors clues that they are a sign of a deeper issue, and what your treatment options are. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. Trigger fingers, medically known as stenosine flexor tenosynovitis, is a condition where the fingers have difficulty and eventually get stuck in a flexed or bent position. It's a reasonably common phenomenon, affecting up to 2% of the population and is most common in women in their 50s and 60s. We'll talk about why this may happen a little later, but first, let's go over the anatomy. So when we talk about treatment options, you'll be able to visualize why we recommend what we recommend. Our hands are remarkable, not only in their abilities, but in their structure. On the palm side of our hands, our fingers are connected to our palm and wrist via a tendon called the flexor tendon. Each finger has a flexor tendon that, when contracted, allows the finger to flex or bend. The flexor tendons are tacked down to our bones by sheaths of tissue. This allows the tendon to contract and bend the finger without bowing out. We have connective tissue sheaths throughout the length of the finger. When everything is working smoothly, the flexor tendon glides easily under that sheath. The sheath that sits at the base of our finger on the palm side of our big knuckle or MCP joint is called the A1 pulley, which you totally don't need to know. And that area can get swollen and stiff. When this happens, the flexor tendon has a tough time gliding smoothly in order to bend the finger and can result in a sensation of locking, clicking, or catching, and sometimes even not allow the finger to bend at all. So now that we know what's happening in the anatomy, what is it that you actually feel? Well, like I said, oftentimes people describe a sensation of their finger locking, clicking, or catching as they try to open and close it. In the beginning, it can be a painless sensation, and because of this, it can be easily ignored. It can come out of nowhere and then come and go randomly. It's suggested that it may be related to overused or repetitive motions, but the data is mixed on that, and I've certainly seen people with it who don't have particularly demanding jobs on their hands. As it progresses, the clicking or catching can become more severe and start to be associated with pain, specifically at the base of the finger where the tendon is getting stuck. This can start to make doing a lot of the things we do every day, like being on our phones, cooking, or driving, difficult. This can happen in just one finger, but often it will happen in a few that don't necessarily follow any rhyme or reason. Oftentimes, as things progress, people find that manual manipulation is needed in order to open up that finger. Massaging the base of the finger to get that tendon to slide open becomes necessary and can become painful. Sometimes, either consciously or unconsciously, we can try to limit our use of that finger, especially if it hurts. If the finger's allowed to stay bent, for example, because it hurts too much to open it, we can develop what we call contractures in the other joints of the finger, making straightening out the finger even harder. Contractures happen when the soft tissues around a joint become hardened and stiff, resulting in a joint that doesn't fully move. This will then lead to the actual joint bones changing, making movement even less likely. So obviously, this is something we want to avoid. When you tell your doctor that you have a finger that clicks or locks, they usually will tell you that you have a trigger finger and then move on. But it is important to run through a quick checklist of other symptoms to make sure the trigger finger isn't a sign of something else. You see, trigger fingers can certainly happen on their own out of nowhere, but they are also associated with conditions like diabetes, rheumatoid arthritis, and osteoarthritis. So I recommend asking yourself, are you having any other joint problems? How do your wrists feel? Are you waking up stiff in your joints? And if so, how long does it take you to get moving comfortably? Have you noticed your hands are changing? Do they look different? Are your knuckles becoming larger? Have you noticed you can't seem to drink enough water lately, or you're peeing all the time? And how's your energy level? Have you been more fatigued or cloudy lately? For most, these questions are a quick nope, 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 nope. Because for most, the trigger fingers just happen out of the blue. But they can help us catch something bigger. These questions will get you and your doctor thinking about the possibility of RA, OA, or diabetes, all issues that need addressing. And if you have no idea what I'm talking about when I say OA or RA, then I would definitely recommend checking this video out next. I go over how to tell the difference between the two, specifically if you're having hand pain, and if you have a trigger finger, then this should be required watching. Okay, so now you know what's going on with your finger. You've run through your checklist and feel confident that you don't have anything else going on. What are you going to do about this finger? Well, first, we need to put on our patient pants, because the first step is what we call conservative management, which means it's the safest but slowest approach. We want to give that stiff, swollen, and inflamed sheath the time and tools it needs to calm down. And the way we do that is by limiting triggering activities, reducing its movement temporarily, and taking anti-inflammatories. Limiting triggering activities can be easier said than done because, it's our hands. We need them for basically everything, which is why splinting can be helpful. Splinting your finger, specifically that joint at the base of your finger, can force your hand to stay in a certain position without moving so the local inflammation can calm down. For trigger fingers, you specifically want to immobilize or at least limit the activity of that first joint. And although I will always recommend getting splinted by an occupational therapist, if you don't have access to one, finding a splint like this can be a good first step. The inflammation, and thus the triggering or locking of the finger, usually calms down after about 4 to 6 weeks of splinting. Along with splinting, you want to take anti-inflammatory medications. This is a situation where I will recommend taking NSAIDs daily, but only temporarily. And remember, this is only if you can tolerate them and don't have any problems with your kidneys, liver, or haven't had any ulcers in your stomach or GI system. If you are good to go, taking a daily NSAID for 2 to 4 weeks can help calm the inflammation along with the splinting. So what happens if you've tried that and it only helped like 10%? Or you can't take NSAIDs because your kidneys aren't working at 100%. Well, the next step is going to be a steroid injection. Doctors can inject steroids in and around that A1 pulley at the base of the finger in order to decrease that local inflammation and get that finger moving smoothly again. Standard practice is to recommend 3 injections about 4 to 6 weeks apart. However, you should notice a significant improvement after that first injection. Now, my training happened to be alongside an excellent orthopedic hand surgery program. So my recommendation, if you find yourself at the point where you've started injections and are still having issues, is to go get a consultation with a hand surgeon. If you have not had a good response with the first injection, you may be finding yourself on the road to possible surgery. And in those cases, seeing the surgeon earlier rather than later is going to give you the best possible outcome. It doesn't necessarily mean they will immediately do surgery. They may opt to do another injection. But if you've tried all the things up to that point and nothing has worked, I would recommend having the surgeon, who may end up being the person to do a procedure, do your next injection. However, if getting into a hand surgeon's office isn't practical for you, then trying an injection up to 2 more times is reasonable. And then when all else fails, there's surgery. The hand surgeon will typically release the A1 pulley, which will then allow that flexor tendon to glide smoothly again, allowing you to open and bend the finger. Trigger fingers can often start out as just nuisances, but can lead to major disturbances not only in our quality of life, but also our hand health, so we don't want to ignore them. Although most of the time trigger fingers just happen, don't let your doctor gloss over them. I recommend asking them, can we make sure this isn't related to some underlying issue that we need to address? This simple question will force your doctor to do their due diligence, and you can feel confident that simply addressing the trigger finger is all that's needed. If you find yourself facing a trigger finger, I recommend watching this video on the difference between rheumatoid arthritis and osteoarthritis in your hands next. Thanks so much for watching, and I'll see you next time.